Hi everybody, this is Dr. Linda Roselle Shannon, President and founder of the Vascular Birthmarks Foundation and co-author of the first book written for parents on vascular birthmarks. The Vascular Birthmarks Foundation is the leading not-for-profit in the world for children and adults born with birthmarks. Our mission is multifold. Not only do we network families into the appropriate treatment, we also educate them about their treatment options, help them to appeal insurance denials, and we are also a leading resource for physician education worldwide. We have networked over 100,000 children and adults into treatment and consider ourselves lay experts. The foundation also sponsors relevant research concerning vascular birthmarks, and we are launching an online course, the first ever in history, for physicians worldwide. Through this course, they'll understand how to accurately diagnose and treat a vascular birthmark. In addition to what our mission is, people have asked me multiple times, what is a vascular birthmark? Vascular birthmarks are benign vascular lesions, the most common being the infantile hemangioma. Vascular birthmarks occur 1 in every 10 births. In the United States alone, based on 4 million live births a year, that equals 400,000 babies that will be born with a vascular birthmark. Fortunately, 90% or a large percent will resolve on their own. However, about 40 or 50,000 a year will not resolve. Those are the babies that we help. Those are the babies that we're concerned with because their vascular birthmarks can become problematic. The infantile hemangioma appears a week or two after birth. It can raise up rapidly. The rapid growth period is from 0 to 16 weeks. They can ulcerate, they can bleed, they can compromise the airway, they can compromise vision, and they need prompt and immediate treatment. The gold standard worldwide is propranolol, a beta blocker, and the only FDA-approved drug is called hemangiol. For the port wine stain, which is a flat red birthmark always present at birth, the laser is still the gold standard. Our experts in the United States believe in starting treatment as soon as 2 weeks of age and continuing laser treatments every 3 weeks. Unfortunately, there are no good standards on laser settings and wavelengths, so we encourage every physician using the pulse dye laser to contact the experts in the United States and experts worldwide to have consistent laser settings. Through our online course, which will be available in the fall of 2017, we will make available courses and modules on proper use of the laser and proper settings. The other vascular lesions that we are concerned with are lymphatic malformations. These are always present at birth, not to be confused with a hemangioma because they never go away, and the majority of them are in the head and neck area. They can often compromise the airway, feeding, and block ear canals. These require treatment with sclerotherapy and surgery, and a new drug is out, sirolimus, which is currently being tested with these lesions and reporting some success. The more complex lesions, the venous malformations, they're purple and blue. They can appear at any time during life, any part of the body, from head to toe, outside and inside. The gold standard of treatment for venous vascular malformations is interventional treatments through sclerotherapy, embolization, and often debulking with surgery. The more complex arterial venous malformations do not respond so well to intervention. They often rebound, and they are often mistaken for a simple port wine stain. In order for these to be effectively treated and removed, the nidus must be removed. That's why it's important for all of these lesions to have proper imaging and have the imaging read by an expert who understands how to differentiate and diagnose between venous malformations, lymphatic, and arteriovenous. There are also many syndromes associated with these lesions. For example, FACE syndrome is associated with a hemangioma. FACE is an acronym for posterior involvement, the hemangioma, aortic, cardiac, and eyes. If typically the hemangioma appears in the beard area, we recommend that you examine the child for FACE syndrome. Just as we recommend a port wine stain that appears in the V1 or the V2 area, that child be examined for Sturge-Weber, which involves brain and ocular, or Sturge-Weber type 2 is only the eye and the stain. Babies should have MRIs done to rule this out. Last but not least is Klippel-Trenaunay syndrome. That's where there is a triad of involvement with overgrowth of bone, muscle, and tissue, and a cutaneous stain. It often appears in the extremity, and the gold standard of treatment is interventional sclerotherapy, embolization, and debulking. We also recommend compression and hydrotherapy. There are many other syndromes and vascular anomalies that I have not mentioned, such as cutis marmorata, telangiectasia congenita, which is marbled, as well as Cobb syndrome. For more information on what the Vascular Birthmarks Foundation does and on vascular birthmarks in general, you can contact us at www.birthmark.org. That's www.birthmark.org. Thank you.